first of all, thank you for being with me today to talk about what I think is an exceptional example of collaboration. And so here we have an example where the government took an initiative that has inspired industry, and I wanted to talk a little bit more about that and how it's all about ultimately helping patients. And so, Adam, you have something called the Blue Button Project that's coming out of the White House. Can you tell us about that?
Absolutely. So first of all, thank you for having us here this week. It's been really exciting. So Blue Button started out a number of years ago, actually, as a side project inside the VA. And the project was really jump-started as a way to empower veterans through access to their own health records. And this became a movement and has now since been moved out of the VA into HHS, Health and Human Services, specifically within ONC, Office of the National Coordinator. And Blue Button now stands for Universal Access to Your Health Record at the push of a button, which is a growing national movement. And this is really supported by some technical standards that the team is working on as well, so that our partners that are implementing Blue Button can actually structure data in a certain way that enables it to be interoperable, so that consumers and patients are now empowered to not only have access to their own data, but be able to move it in and out of the system to engage in whatever healthcare needs they have.
So Jennifer, tell us about the Blue Button Project at Pfizer. A similar concept?
It is. So Pfizer had been looking for a way to give patients who participated in our clinical trials back their data. And we had been looking for a couple of years. We had the concept, and there just really wasn't a feasible way to do it. And as we started to learn more about Blue Button and what the VA was doing with it and others, we thought this was an excellent opportunity for us, and finally a way for us to be able to give patients who participate in our trials back their clinical data. So we had some discussions with Adam and his team at HHS, and internally started to concept how could we actually utilize Blue Button. This was an excellent standard that was available and something that could be scalable. So other partners, Aetna and other parts of the healthcare industry, were actively using Blue Button, and now this was an opportunity for us to also use it in a new, innovative way to be very patient-centric and give patients back their data who are participating in our research.
Well, now, is it fair for me to say that Pfizer is the first to initiate this in industry?
We are the first. We're very proud to be the first, and we are especially proud to be a part of Blue Button, partnering with HHS, the Office of the National Coordinator, and others, and have this great public-private partnership. The future vision is to arrive at a place where whatever data is collected in a clinical trial, individual patient data will be given back to them.
We're really excited by the opportunity to have Pfizer participating in this, because I think for the first time we're going to be seeing big holes in people's health record, which have typically existed because a lot of their treatment in a clinical trial happens outside of their typical subspecialist or general practice, and for the first time those holes can be filled. So the most innovative treatments in the world that are happening in clinical trials can now start filling some of those gaps in the record. And I think one of the big challenges is going to be, how do we actually move that data back into the traditional electronic medical record system if it's not necessarily part of the Pfizer ecosystem today? And it's also a national priority. Blue Button fits within a larger construct, which is part of the White House initiative called My Data Initiative. And My Data Initiative gives consumers access to their data across healthcare in the form of Blue Button, energy data in the form of Green Button, and education data and financial data. And so there's a whole initiative that's really, I think, powering some of the momentum here to really empower the American people to have access and to take action on the data that they are helping to generate.